So anyways, there's a group that I believe they're working with Renal Association.
The Ontario Renal
Renal,
Yes.
so is that right? That's trying to identify need and all this. So anyways, so down the road, that's certainly something that.
Well, we were just able to announce dialysis at Renfrew Hospital.
Much better.
So this is a great example. ENITS, emergency
Neurological
neurosurgery.
image transfer service.
system.
Exactly. Very
Yeah.
good. Very good.
Yeah.
I don't know what it is. So very good. Very good.
So this is eHealth.
E-health works.
So it costs $2 million. Where's the media here? $2 million
Huge
to
benefit.
put together this program called ENITS, Emergency Neurosurgery Image Transfer System.
Yes. Very good.
So somebody with a head injury, say someone's in a car accident
Exactly,
here, comes in, they get the CT scan done here, immediately in real time, a neurosurgeon in London, say,
Hamilton, Toronto, wherever.
there's somebody on 24/7, can see the image and can make a call. Do we transport the system or do we stabilize this patient where he or she is right now? So it cost us $2 million to put in place this system. It saves us $50 million a year in unnecessary patient transfer.
Yeah.
It's unbelievably, this is just another example of how technology, if it's used wisely, is so much better for patient care, because if they don't have to be transported, it's way better not to transport. Yeah. And 20,000 people here.
20,000 people here.
Great.
So we're going to go see the CT first.
Wonderful.
Which is around this way.
We've taken some pretty strong steps. By 2013, we will have doubled the number of doctors graduating every year. We've reversed the brain drain so that more people are actually, more doctors are actually moving into Ontario than leaving Ontario, more doctors. So I think last year 179 more doctors decided to come back to Ontario, which is pretty impressive. So that access to primary care issue.
Be into Havelock, Marmor, which is north of here.
That's writing right there.
So do you have people coming from outside your catchment area to get faster CT?
Well, we have some patients who will come here just to get faster response
Yeah.
times. That's what it's meant to be.
$50 million in savings, and cost us $2 million to put in place.
Yeah, the docs and the specialist time and the nurses, I mean, once you know what you're doing, I mean, it's.
Oh, yeah.
Yeah, it's a lot simpler. Oh yeah, just and it's better for the patients. Bottom line, it's better for the patients.
Absolutely.
It's the worst place to be is the back of the ambulance. Unless you need to be there.
Unless you need to be there, and then you need
it's
to
a
get there.
savings. It's just getting people where they need to be.
So it's
So,
fantastic.
yeah,
It's fantastic. It's why we need to just keep moving forward on eHealth.
Exactly.
Because there are so many more examples of how eHealth
Yeah,
is
we use
really improving
all the
care,
time in a
saving
sense
money.
with our PAC system. I mean, right
Yeah.
now too.
Yeah. Great.
They got a very, very smart, it's large. Maybe folks get help from.
We've now got doctors in Lou's riding and in my riding, doctors with signs out front saying accepting new patients. And that was something that we didn't dream of 8 years ago, just 8 years ago.
I always said, I don't mean to interrupt that I didn't think I'd ever live long enough to see that day come. Not that we still don't need more doctors. I mean, because we have a certain population of doctors that are in their days of retirement, but we certainly, the other piece that I always say when I come to hospitals, either is the fact that, hospital boards and staff took over the slack when there were no doctors, because everybody used to land into the emergency room, right? The hospitals became a catch-all, which they should have never been. So they did a great job to, to help people.
No question about it.
And you can see we have it also associated with refrigerated medication as well.
Oh, and that's all locked up too.
Yeah.
So it's activated by the thumbprint.
Yeah,
is
or
what
if
it
I
actually
don't-
is,
if that
and the
isn't
password. We heard some pretty compelling stories about why having the CT scan here is really making a difference for people in this area. And I guess, just to underline that this happens at a cost. There is no, this isn't free. This is because our government decided to make investments. We take heat for the tax, the health premium, But I tell you, that health premium means better care. And there's a party out there who wants to cut taxes. And I tell you, they will do it at the expense of health care. So we're at an important juncture in Ontario right now. We spent 8 years rebuilding. We're excited about our vision for the future, providing better care for seniors particularly, to keep them out of hospital, to keep them out of long-term care. And this supportive housing across the way here is a great example of, if you provide supports for people in their own home, you actually can keep them out of hospital, out of long-term care, where they want to be, which is living independently, choosing what they have for dinner, choosing what time they want to wake up and how they want to spend their day. It's a much brighter future for the seniors as we proceed to provide better supports for people. But we need a mandate on October 6th to continue to make progress when it comes to health care. Well, and this is what the Rural and Northern panel really found, right? That you can have wonderful advantages in smaller communities because you really can get all the healthcare services working together.
That was chaired by Kelly.
Yeah, that was chaired by the former CEO.
Okay.
Yeah, so she did a lot of work for us.
Oh, I hadn't linked that, of course, yeah. I just want to be here to congratulate Lou for having made a profound difference, because he's a scrappy fellow. I tell you, Lou does not take no for an answer. And when he's got an issue in his riding that needs to be addressed, he keeps on working until we find the right solution. So.
And for places like this, I mean, I think I mentioned earlier, it's worth repeating. Not only the hospital, the foundation, the community really rallies around that. I mean, unfortunately, the mayor couldn't be here today, but he's a cancer survivor. He just went through the process. He's flying to a warmer place today, much needed. But, you know, he took some heat when the tax levy was put on because he knew how important the hospital was. So the community stepped up to the plate. You know, it's been really, we had a document burning ceremony when things were came off the taxes, right, Neil?
Well, and the entire council that voted that in got re-elected.
Yes.
And they all had the healthcare levy as part of their why they were so proud of what they had done.
And how much was it per household?
It was $35 per household, and it generated about $1.2 million over 5 years.
Fantastic.
So I mean, it makes it. I mean, Frank, that's the type of things that as the MPP for the area, and I'm sure it's the same for them. That how can you say no when you see that groundswell of support, you know, coming locally, you know, so you can't say, well, no, I'm not going to try to help you achieve that goal.
Yeah.
So it's more work for us, but at the end of the day, it's a good result.
And, you know, their expression is hands in the mouth is money in the pocket, which is true, right? So we'd have an hour, they'd be waiting. So now at 2, we can double book and have a hygienist come. So it's terrific. We're doing well. Yeah. Our dentists are retired dentists.
I want to say thanks so much, Lou, for inviting me to come back here. And John, thank you for your extraordinary tour. The enthusiasm you have and your determination to provide better care for people is just so admirable, and I just applaud your ingenuity, your creativity, and just your commitment to the people you serve. You know, and then you've got the diabetes education team.
Yeah. 3 teams.
3 teams.
Yes, we've been bumped up to 3 teams.
Yeah.
Plus a clinical coordinator. That's why we needed extra space.
Yeah. And what else do you offer?
Well, we do our lab. We have the blood work, venipuncture, etc. And then we have a very active community dietitian. We have a garden.
The CHC model for me is one of Ontario's gems. It really is an exceptional model of care because it focuses on wellness. It's not just about helping people when they're sick, it's about preventing people from getting sick and being there early, identifying some of the signs that they might be in need of care in the future and getting out in front of that.
We partner with PARN, the Peter AIDS Resource Network. They come down
here.
Say that again? I'm sorry. The Peterborough AIDS Resource Network.
Okay.
And they do needle exchange, harm reduction here. And they partner with other community agencies, the health nurse, the C nurse, etc. They'll all come in and work with the clients that are coming in, and they have some privacy there.
So I was here a year ago to celebrate the addition of 2 new, I think, diabetes education teams, bringing it to 3. Diabetes is one of those chronic diseases where we just know if we invest early, we can really slow down the progression of the disease and prevent pretty serious consequences of diabetes. So we are absolutely committed to the CHC model. In fact, we're about halfway through the biggest expansion of CHCs in the history of Ontario. We're doubling the number of CHCs, doubling the number of clients of CHCs because we are so committed to this model.
Activities. And of course diet and weight and obesity and healthy meals, and we do it all. And targeting the kids is so important,
So
right?
part of our platform is to tackle child obesity.
Yes.
We want to reduce child obesity by 20%
Right.
in 5 years. We know that's going to be a combination of better diet
Right.
and more exercise. So
Yep.
there's going to be even more demand for teaching kids and their parents how to prepare meals that are healthy.
Well, you get some of your staff to contact the families that sent their kids here. They sent us glowing letters. So it was quite interesting. They came back and said the wrap was delicious, and we're hiring a recreation activity.
And because of the investments that we've made, we're now able to turn our attention to what is, I think, the next stage of healthcare, and that is the focus on prevention. So preventing people from getting sick. We've got some pretty big goals in our platform. We want to reduce childhood obesity by 20% over the next 5 years. That is an audacious goal. It is to reverse the trend and make that kind of progress, but we know we can do it because we've demonstrated our ability to get things done.